Ado and welcome to this edition of the program City and Health Watch, where they reach you from a studio in Mount Orel, FM 107.3 for Abbey College. Inside the program, we talk about Fistula, the way they make the program reach you. My name is Zaina Barmansere. Well, for help you know more about Fistula, my colleague Lucy Imanet Aliu Bingo Waka na the Abadi Women's Center. Usa been first talk to Alexandra Ribi, the program's manager Aberdeen Women's Center. Alexandra Ribi been start for tell me about the Aberdeen Women's Center.
So here there is four main things that we do, but there's four main things. So the four things are maternity, fistula, teenage mother empowerment, and we have an outpatient children clinic. So these are the four things that we do. So the first one, let's talk about the fistula. So most people, when they hear about Aberdeen Women's Centre, they think of fistula because so we are the only place in the whole country where if you have fistula, you can get the surgery you need for it to be fixed. So I don't know if you know what fistula is.
No, really.
So it's very common in rural communities because it's when you have a labour, you give birth, and it's very long and it's obstructed. So there's maybe a complication or things like this. And if you do not get the medical help you need, maybe the baby will come out like not the correct way. And basically fistula is what happens when, my fistula nurse can tell you in better terms, but it's basically when the baby presses down on your bladder and it creates a hole between your bladder and your vagina. So what happens is you basically just leak urine and you have no control. You know how if we want to go to the toilet, we can stop ourselves from going. Like we can say, I will go in 5 minutes, or you do not just have you understand?
Yeah.
So it's where that goes. So there's two types of fistula. One is where it happens with urine. The other one is what happens with like feces, like poo. So it's very, as you can imagine, it's very embarrassing. And here in Sierra Leone, it has a very big stigma, a big taboo, because people think like they are wicked, these people that do this. So a lot of communities, they sort of stigmatize and look down on women who have this. So that's the first thing that we do. So we do the surgery here. Every year we do around 500 surgeries a year, which is a lot. So because each surgery, what happens? So how people say, how do you find the patients if it's so stigmatized and people don't come forward? So what we do, maybe around 4 or 5 times a year, we will go on screening trips to all the districts. So we are going on one ahead of this camp. We are going on 2 screening trips where we are going to visit 8 districts, and we go to all the community health centres and we engage with them. We explain what fistula is. And then we say, if there's anyone who has these symptoms, please come. And what we do here is we pay for the transport. So if someone thinks they have fistula, they can ring us. We have someone on the phone 24/7. They ring us. We have this few questions we ask them, and then if they answer yes and things, you can tell that they have fistula. We then pay via mobile money for them to come to Freetown, or if we are already in their district, we just bring them in our car. Then they come here, they are screened by our nurse, then they have their operation, which is a very complicated operation. So one reason why here we are the only place in the country that does the surgery is because can do this surgery, because it's like you go to medicine school to be a doctor, then you do some more years to be surgeon, and then you have to do even more to be fistula. So it's very advanced. So not many people do. So unfortunately we don't have a Sierra Leone national as our surgeon.
Okay.
Because in the past we have trained people, but then normally they go abroad because they can get more money, really.
Yeah.
Or maybe they just, I don't know. But so we have never been able to train someone and then for them to stay here. So we rely on expatriates coming. So from the US, we rely on doctors, really, surgeons coming from abroad. So soon for the camp, we are having an American doctor who's going to be here for 4 weeks, and he will try and do as many surgeries as he can. Per day, I think the maximum surgeries we can do in one day is 3. because they are very long and very complicated and yeah.
What do you mean they are complicated?
Well, it's a very complex operation. It's not like they just go and like, it's a long operation. So you cannot just, we cannot do like 20 in one day, you know, like, so it's just the maximum we can do in the hours in one day is 3.
Oh, okay. But again, does fistula has anything to do with rape?
So you can get fistula from giving birth. You can also get it from rape. So these girls that just came to our door, these are all girls at the minute we have here who have been raped. So, and one of them definitely has fistula. So yeah, you can also get because of that. So that they're the 2 ways that you get fistula.
Okay. So what other ways or what other things the organization does to help women?
Okay, so the second thing we do is maternity. Every day we deliver about 10 babies. So our maternity, we get people, everything here at the Aberdeen Women's Centre is free. It's not charged. Even the medicine, even the pharmacy, everything is free. As soon as you walk through the door till you leave, it's free. We get our patients mainly from the slum communities and the very poor communities of Freetown. So our maternity patients, our midwives, they go out to the communities and they book in women, pregnant women, and then they come here and we see them right through from when they are pregnant, we give them a scan, right through to delivery, and then afterwards all the way to antenatal checks. So I think to date, maybe we have, it says here, we have delivered around 10,000 babies, and we have a very low maternal mortality rate, and I think apparently this is meant to be the 2nd busiest maternity ward in the country.
Wow.
So it's very busy. I will take you, when we go, you will see how busy it is.
This na CTN.
Listener, if you choose the twinning, this is a program CTN Health Watch where they reach you from the studio in Mount Orel FM 107.3 for Abbey College. And inside today's program, we talk about fistula. Me where they make the program reach you, my name is Zaina Bamansere. Well, for help know more about fistula, my colleague Lucy Imanet Aliu been go work at the Aberdeen Women's Centre. Usai been talk to the program's manager Alexandra Ribi and Feremusu Kamara, when a fistula supervisor at the Aberdeen Women's Centre.
Okay, so apart from slum women, do you also cater for other women?
Unless you are booked by our staff who come to your community, we do not take women just at the gate.
Oh, so you concentrate on the...
So we have a very sort of strict criteria of who we concentrate on. But there's one difference to that. So apart from that, we see any teenage mother that comes to our gate. So sometimes, mostly we find them when we go to the outreach and we book them in as well. But if any teenage mother turns up at our gate, we will see them. So our teenage mother program, we call them Dream Girls, and we see them the same as the maternity patients. So right from the beginning, with the scans, all the way to deliver and then antenatal. But with our teenage mothers, we offer them weekly education classes and like a safe space really to come and to meet other mothers. So that's what you just saw me do upstairs when I was writing those. So on a Monday, we have lactating mothers. So mothers, after they have given birth, they come every week. We pay for their transport to come and go. And we provide them with classes. We do skills training, a basic education. We do sort of arts and crafts. We teach them to sew, so everyone will go home with a blanket and a rug that the cloths and things have been donated to us as a charity, and then they learn to sew it and then they can take that home. So as well as this, some teenage mothers, when we come across them, sometimes we also have on Wilkinson Road, we have a girls' hostel where at the minute we have 12 girls living and their babies. So this is to provide these 12 girls. We are sponsored from a charity in Australia who called the Aminata Maternal Foundation.
Okay.
I don't know if you've heard, but
Yeah.
these girls basically are given 6 months of very in-depth education and training, mostly around catering and hospitality and things, in the hope that then, once they have finished their 6 months with us, they will be then more educated, have more training to be able to then get jobs. So we have a big sort of teenage mother focus. So on a Monday from 9 till 12, we do this lactating mothers.
So do
mothers,
you do that for every teenage mother?
every teenage mother, we offer it. Not everyone comes, but we offer. We explain to every teenage mother that comes here that you can come on a Wednesday. We do it for pregnant teenage mums.
Okay.
So on a Wednesday they can come from 9 till 12, the same. We do the education, the skills training, and we pay for their transport. And then once they have had the baby, they can then move to our Monday class, which is the same, but just for people after they've given birth. So then the final thing we do here is we have an outpatient children's clinic. So every day we see around 100 patients, 100 children, and it's open to any child, really, that's under the age of 15. So we see people right up to 15. Twice a week our clinic goes out to Crewe-based slum to do an outreach in the slum area. So we see children, we see them for malaria, for skin infections, we give them vaccinations, and I'll show you once they have seen the doctor or the nurse, any drugs that they are then prescribed, they can get from our pharmacy on site, and it's all for free. So these are all the things we do here.
All right.
This na CTN.
Listener, if you choose the twinning, this na a program CTN Health Watch where they reach you from a studio in Mount Orel FM 107.3 for Abbey College. And inside today program we talk about Fistula. Me where they make the program reach you, my name na Zaina Bamansere. Well, for helping know more about Fistula, my colleague Lucy Imanet Aliu Bingo Wakana at the Abadi Women's Center, Usai been talked to the program's manager Alexandra Ribi and Feremusu Kamara when a Fistula supervisor at the Abadi Women's Center. Alexandra Ribi been start for tell me about the Abadi Women's Center.
So how's your outreach program done?
In Crewe Bay.
Is it only in Crewe Bay?
Yeah.
Okay, so how do you go about doing it?
So twice a week, a nurse and our doctor will go out in our ambulance. They will take drugs and they will basically have a clinic, but just like a mobile clinic. So instead of them coming here, where they would have to pay for transport to get here, it's like we go to them. Yeah, so these are all the things we do here.
So, but why only Crewe Bay?
I don't know. I think because it was set up a long time ago.
Oh.
So it's always been Crewe Bay from when I can remember. So I'm not sure maybe why that was first chosen a few years ago. Yeah, I'm not sure.
And there are no plans to move on?
No, because we are so busy when we go there.
Oh.
So it's like maybe if we were not as busy there, we would then maybe think about going somewhere else. So yeah, I think that's like a summary. So let me give you a tour maybe, and then you can speak with our head fistula nurse, because I am not medical, so she can tell you all the medical terms, you know.
Okay.
These are all the labour rooms, and then this is where we weigh the babies when they are just born. Sometimes when you come here, I show people there's a baby. It's like I planned it. It's like a new baby. So we have 14 beds in here. We have showers and toilets and everything for the patients.
That's nice.
So if they give birth like normal birth, after birth they stay here for around 8 to 12 hours after. If they have a cesarean, because I will show you, we have 2 theatres here and surgeons, so we have a surgeon on call 24/7, so we can do cesarean sections anytime for any emergency. If they have a cesarean, they stay for afterwards, exactly. But obviously every one of our patients are checked by the doctor before we discharge them, and if say they are sick, we don't say, oh, it's past your 8 hours, please go, you know. That's just a general rule, like that's like maybe the average, you know, but depending on the patient, the baby.
So all of these patients, they do have food. All of these patients, you provide for them food?
Yeah, so I think once they are in here, we provide food, and sometimes they bring as well.
Oh, okay.
I'm not sure if I think it's a bit mixture.
Yeah.
Because sometimes you see people bring food as well.
Yeah.
So I don't know. I say, oh, I thought we gave you food, but so I think it's a mixture.
Okay.
But for our fistula patients, we give them the food. Because normally our fistula patients, like I said, they have come from the provinces. Because most of these maternity patients, they are from Freetown. So normally, say, maybe their family could bring them some food because it's not too far,
Exactly.
even if they are from even region. It's far, but not too far. Whereas our fistula patients from all over Sierra Leone. So someone cannot bring them food from Kono or something. So that's why. This is our maternity. It's always very busy, as you can imagine, and sometimes very noisy.
Yeah, with the kids.
Yeah. Okay, so we'll go back through here. So yeah, we have the lab. You can see everyone lining up for their lab. Now, one thing which we do here is when you give birth, normally you lose a lot of blood. Okay, it's like, and it's obviously one of the concerns, like one of the problems that you can have is, you can bleed out. So you will need maybe a lot of blood. So what we do is, because blood is very hard to find here in Sierra Leone, and it's not like good blood, you're not sure of the source and things like that. So every time someone comes to give birth here, we ask that one of their relatives come and gives 1 pint of blood. We don't force them, but this is just what we recommend, so that in our lab we have a big fridge and it's always full of blood, so that if in theatre there's an emergency, we can just go and get the blood. Like, we don't have to wait until there's an emergency to then find. So this is just, I don't think it's happened maybe, because Aberdeen Women's Centre has been here since 2005, so a long time. So I don't think it's always the blood, I don't think it's always been here. I think it's just something they learnt and they said, oh, this is a good, it's a good thing to do. So maternity, we've done that. So we have another maternity ward over here. Now, just down here, this door, we have, which is relatively new, we have a family planning service. So we, and basically 80% of the people that we see are just walking. So we don't, we should go out more and do outreach, but at the minute we just don't have enough staff, but most of the people are outreach. So I think every week probably we see around 200 people, but we do everything: implants, coils, injections, the pill, we do it all. And we offer it to our maternity patients and even our fistula. Anyone, basically, we offer. So, yeah.
And it's also free.
All free. Everything here is free. Yeah, so I forgot to mention. So, we have another maternity ward over here. I can quickly show you. It's just the same, basically. But this one is normally for after they've given birth. That one was before, with those rooms.
Yeah.
This one it's not only for after, so it's another. I think it's 14 or 15 bed. So, and just say we have the bathroom there. So, as one of the 2 wards for maternity, we have 2 fistula wards. But at the minute, the only fistula patients we have are our girls here that are childbearing girls. Because we are waiting for the camp. So in that camp we will be so busy. We are trying to target like 50 patients just for that month. So, which is a lot. I hope we will get 40, but we are aiming for 50, yeah? With your help, we can get 50, yeah?
Okay.
So these wards I can show you, but they are just empty for now. But they're very similar. They just...
Oh, these are the fistula beds.
For fistula, yeah. So we have this one and we have another one upstairs.
Okay.
So they're just here with the toilets and the showers. So it's like all of our wards are laid out the same, with the ward and then the toilets and showers.
So how long is this camp going to take?
How long is the camp? It will be 4 weeks. A 4-week camp. Our surgeon will be here for 4 weeks. So this is our theatre. We can't go in, but they have 2 theatres. One which we always keep free in case there's an emergency. The other one is for more like scheduled. Okay, so this is our outpatient clinic. So what happens is they come through this door. This door goes onto the main road, like by the Radisson. So this door is open every morning from about 7 in the morning till about 10. And basically people have to queue up, and we basically see the first 100 people. And then that's our maximum that we can take, and every day we have to close the door and send people away. We are always more busy than we can manage. So they come through here, then the nurses here, they take their temperature, they do like triage, and then if they are very serious, then they can go to the front of the queue. If not, they just wait, and in here I will show you, we have both nurses and doctors. Because maybe some people, like some not have to see the doctor, some can just see the nurse, but then some of them more serious, they see the doctor. And then whatever they prescribe, I will show you, our pharmacy is here. So down here we have our nurse and doctor, the office. This is really the hospital. We recently, we have now started to take more rape victims. So it's something that we are looking at expanding. We are hoping maybe turn one of our wards. We have a spare ward that's not used. So we are hoping to maybe turn it into like for very severe rape cases, because we are seeing more of them.
Yeah.
And we are getting busy. And the thing is that when we have our camp, our fistula camp, we will not have space for them.
Okay.
So at the minute, I am trying, maybe by next week, we will refurbish one of our old wards, and then we will start doing some explaining to people that we now offer this service.
Okay, don't you think, earlier you said you think that has effect on your work?
No, we make sure that we always have enough staff for the amount of patients that we see. If we had more staff, we could maybe see more patients, but for now, our staff levels are enough. So for example, we have one midwife for every 2 maternity patients, so which is good, because I tell you, if you go to PCMH, or you will not get one midwife for 2 patients. You will get maybe one midwife for 10 patients. So we have very high staff levels, and we are very, we could see more patients, but we would have to let our staff, you understand, like maybe say if the management, we said, okay, let us see more maternity patients, our ratio of midwife to patients would be more, but we will not do that. So our sort of rule, it's not a rule, but how we do things is we always make sure that the patient care always has enough staff, and we don't compromise on the standard of the care.
So you concentrate on quality.
Exactly. Even if we have to do less and see less patients, then that's just that's what we do here.
Maybe it would be better for you to see more patients. So don't you think working with the government will be of any?
So we work with the Ministry of Health very closely. So we have, I think, around 24 staff from the Ministry of Health who work here. So they get placed here. So midwives, we have medical officers, we have nurses. So we work very closely with the Ministry of Health. And even just, I think 3 weeks ago maybe, we got 2 new midwives from McKinney, from the midwifery school. So we do work very closely with the Ministry of Health. Yeah, we are always trying don't want to be separate. We are not we want our hospital here to be ingrained the government as much as possible.
This na CTN.
Listener, if you choose the twinning, this is a program CTN Health Watch where they reach you from a studio in Mount Oral FM 107.3 for Abbey College. And inside today's program, we talk about fistula. Me where they make the program reach you, my name is Zaina Bamansere. Well, for helping about fistula, my colleague Lucy Imanet Aliu been go work at the Abadi Women's Center. Usai been talk to the program's manager Alexandra Ribi and Feremusu Kamara when a fistula supervisor at the Abadi Women's Center. Now na time for news. After the news, we come back and continue with the program.
This na CTN. This na CTN.
Welcome to the second half of the program CTN's Health Watch where they reach you from a studio in Mount Oral FM 107.3 for Abbey College. Inside today's program we talk about fistula, and where they make the program reach you, my name is Zaina Bamansere. Well, for helping know about fistula, my colleague Lucy Imanet Aliu been go work at the Aberdeen Women's Center and talk to Alexandra Ribi, the program's manager, Aberdeen Women's Center. Inside the first half of the program, Alexandra Ribi don't tell me about the Aberdeen Women's Center. Make we now hear from Feremusu Kamara, when a fistula expert nurse at the Aberdeen Women's Center.
Fistula na an abnormal opening na either the bladder or the rectum. This they occur as a result of prolonged and obstructed labor where woman go for go born face this circumstance, like the woman will be born for himself, it dey into labor for a very long time, when as a result of prolonged or obstructed, like either one or two complications will lead to the fact that the woman will be born the pikin by himself. So during that process, the way the woman dey into that prolonged obstructed labor, the baby dey press on the piss bag and the toilet bag. So as a result of that, the way they apply pressure on a particular side, let me say that woman only in labor like a 1 day, 2 days, 3 days, as the case may be. So due to that pressure, the blood supply at that particular side they cut off. So even after that woman go down born, because of that blood supply be don't cut off at that particular area, it can cause at the end of the day for the woman like a 3 days after the woman don't born, that tissue, also that blood supply be don't cut off, they die. And when tissues then die, it they come out. And when it come out, the woman will begin find out say it they leak stool or urine. Sometimes like you leak both stool and urine. So that leakage will they call that incontinency of stool or urine, that we refer to as fistula.
Alright, but now born when person they try for born and they get complications during delivery, and I know what they cause fistula.
Yes, 80% na in they cause fistula. We get what we refer to as ureteric fistula. That is like a woman then we can go through like a CS or any abdominal surgery will involve the belly. So they interfere with something called the ureter. That ureter like now the piece rope will connect the piece bag and the kidney. So like at times the surgeons then can misplace them or they can interfere with them. Itself can cause leaking. But most times with cases that they get and as a result of delivery, now the woman gets this fistula.
Because I'm made for understand say rape also cause
fistula. Like on rare occasion, especially for them small picking them, because we can get like a few cases there at times. Like we get like we say like a trauma. Like this man now, this picking very young and tissues then tender, and that man go like go get forceful sexual intercourse with that picking, in that intimate it will interfere with the bladder. It can cause incontinence for the picking. We can get like a 1 or 2 times. We can not get in cases then it can come.
Okay, earlier you made mention of the urine fistula type. So how many types of fistula are there?
Well, fistula we get 2 broad classifications. When are the VVF, then are the vesicovaginal fistula. Then are like woman where they leak urine normal. Then we get what we call the rectovaginal fistula, where the woman get incontinence of stool. But at times some can get na the vesicovaginal no more than can get when the piss no more they come out the piss. Some can get both the VVF and the IVF, who they refer to as the vesicovaginal and the rectovaginal fistula, where the incontinence, the woman they leak piss, the stool from in vagina. You know the toilet from the normal side again. Now from in vagina the stool they come out. As soon as it feel for get the urge for pass to they come out in vagina. Or at times it come out they know.
So then they all born
yes.
Delivery complications.
Yeah, delivery complications. Because the woman in makeup, like when woman they born, like the bladder they up, the rectum on the toilet bag, they don't say bladder now for the piss. The rectum na the toilet, na the toilet bag. So like when that picking aid the press. So tell the woman, most times again teenagers then, they still they grow. In pelvic not don't develop it. So the baby big, it just don't can't stuck. That makes it obstructed. It just don't can't stuck on that particular end. So when the aid the picking aid when they press on the bladder way up, it they press down on the rectum on the toilet bag. So after yes, so that can lead to this fistula.
So what's in the effect where this can get to the person?
Now it gets so many effects. Now fistula is a condition where it gets a lot of stigma we attached to her. Imagine you as a woman, you just they leak urine, you know they able to control yourself. And most times now the rural communities then the hygiene poor. Now pieces then they use. Not so like where we they free here we they use diaper. So as a result of that, the man they can abandon them. You know say upland then get their own perception about fistula. Can say sometimes you they cheat on your man, or sometimes you they witch. Now make you go for go born. Now as a result of that day, or sometimes you don't sacrifice, or you get for the sacrifice, you know biggie. Now in the little, so you just go to leak urine and the offensive smell. Most of them can go into isolation because number one, and then they get the courage for mingle with them company woman there. Yeah. Because any say oh they can the smell, everybody they shame them, they tell them bad one, they call their names. Some can go into a depressed state. Imagine this man your own as who they try to get this speaking. You don't can get this condition. Your man don't abandon you. Your family will not abandon you. Nobody no one forget nothing for do with you. They can go. Someone can begin behave like they can get like a psychological problem like even when we can cow the person get for go like a through counseling process because it's not easy. The stigma they can face, the isolation, the depression, all can tell on them. So like a fistula na a condition like we really need attention because it really affects the woman, especially in the rural community. It's not easy.
Okay, but treatment day, how una can go treatment day for fistula, then how una can go about for this treatment?
Well, now Abadi Women Center, since we are a non-governmental organization, we screening trip where we can organize. We the nurses, the one the fistula nurses, the we know what's in a fistula. We can organize trip where we go upline. When we reach upline, we can do talk shows, we can do radio announcements, at least for sensitize people and tell us within the community. We can reach out to the PHUs, the small health centers because at times they can know about them in the community. We can reach to them so we there. Because most of them believing for born na house than they go to hospital. So we can reach to them so we them. So we can interact with the chairman. At least make them able to locate the woman there in the community because in a condition where person gets in a community, not ask for no. Because if you get one particular woman, we always in the isolate himself from everybody. No say if you check and find 80% if you judge them now like a fistula case, we cannot elect for mingle at all. So we can go, we search for the woman there, where we able to identify them, we screen them. Screening are the process what we can do for able to identify if really na fistula this woman is suffer from or if na any other condition. If we screen, we see na fistula you get with the carry it in a yard, where we carry them, we test, we run test panel for check them if they physically fit, if no other condition, not the way they affect them, then we plan them for surgery. Fistula not the meant by taking medication, not only when they do surgery because na all way door open, like where I say. Now all way door open na either the bladder or the rectum. So they get for do surgery for close that all day back. So the only way they can, we prepare them, we treat them. If some can malnourish, we can treat them first, put them high protein. Some can get high blood pressure or diabetic, it not be known because no they go hospital. We can treat, then we plan them for surgery, and then do them surgery. Then most times the surgery is successful. But some can need for go under one, some can go under 1, 2, 3 surgeries before ever it is well.
Why 1, 2, 3 surgeries?
Like everybody gets ayonki. Some people like get a very small fistula.
Okay.
So then it depends on how the severity of the damage. Some man the hole can so big, like the first surgery then go try for like do something for make it small. Second surgery then small, and the third surgery for close and completely. Some man even after when I cannot do the surgery then safe. Some one can damage bad when I cannot do the surgery. They no go ever dry again because the bladder don't damage to a fall that when they do the surgery, the bladder is small, the capacity. So just imagine some person in bladder is supposed for all, let me say normal for say 3 liters of water a day. They can say they can't do the surgery, the bladder don't small, the bladder capacity don't even take up to 60 mils. So obviously that kind of person no they ever dry. That no can call and say it gets stress, incontinence. So that kind of person no they ever dry. Okay, even get some day after when no kid operate them, they not keep born again. So no kid operate them, some no allow them for born for themselves again. So this one a condition where really hard again.
So what are some of the dangers where like what you mentioned earlier says until the person not good for born again and what are some of the other dangers that we associated with fistula?
Well, one of the main danger like where I say most times some not able for born again for themselves. No allow themselves, not allow them again for born, forget normal vaginal delivery. If they get belly pass then we do CS then pull the picking. Because if you go born for yourself back, it reoccur, the side open. And again, most of them not born again. Because imagine we don't get cases that woman on in labor, picking on die at the belly. It didn't labor for 1 week. The picking don't die. At the end of the day, that womb started picking the little one of the uterus, all done damage. So pass them pull down the all. And when most of them are the firstborn, then they get this complication. So imagine that picking on that belly pass 4, 5, 6, 7, say 1 week, then can pull the die baby, then pull all the womb. There is no way you can born back.
Okay, so what's some of the things that we can cause then complication there? So?
One, like what we say, home delivery. That make we they go na them community, yeah, we can talk to them. When you get belly, go na hospital. Like we say that antenatal visits. where they go belle say belle woman get belly for una clinic. At least if you go clinic, if any complication get for arise, if the baby big, they say this no go born for yourself. Then go say we belly at calm, then we do operation.
Yeah, then we don't know before
time. Then we don't know before time waiting for do. Now you go born to this mommy now us. Medical this mommy no know. You don't know if the baby big. You don't know if you feel you physically fit for born this baby for yourself. You go to born to this mommy now. The mommy they force born. They chook sign up for chook. Because you don't know. Now just guess no more if they guess for do this delivery. At the end of the day, some people like unfortunate them born for themselves fine. But at times you go born, you go get this prolonged obstructed labor. This mommy are no medically inclined, also midwife. You go left for the delay, you say you left for chuk at the end of the day. You can't lose the baby at the end of the day, you can't develop fistula because you go chuk sign up for chuk. You end up can give you problem. Then again, late referral. Like I say, some birth attendants or some midwives there as working as a nurse or as a medical person, you get for know your limits. If you don't get this particular client in a facility, let me say then health centers or them PHUs, they are not well equipped for conduct surgery. You don't get this woman, you don't come for Cambona facility. You don't say and say this woman yeah, he may let at 1 day, 2 days, 3 days. You know able born for himself. But you still the keep her name. Because you know as a midwife, you know woman when I first born, almost hourly for taking labor. Woman when I second or third or fourth born, you know almost hour for take. If you see say that woman they you don't exceed the number of hours wait for take, you refer. But sometimes like you don't delay with the woman and say by the time they refer them now, water don't pass Gary, late referral. Then again, what can cause this? Let me say this teenage pregnancy. Then picking the waves very young, they see picking at the age of 13, 14, not saying that married those. Obviously, say picking a married those, the man they expect her for born. Early marriage, the man they expect her for born for her. Because I'm a woman now. That picking go get belly for that man. That picking still they develop. In order to fully go it for able born picking, it go get belly. Most times we can get teenagers the way they are affected by this. Because in pelvic very small, you not get that enough capacity for push picking for born baby for itself. At the end of the day, they can end up develop fistula. Yes.
This na CTN.
Listener, if you choose the twinning, this is a program CTN Health Watch where they reach you from a studio in Mount Orel FM 107.3 for Abbey College. And inside today's program, we talk about fistula. Me where they make the program reach you, my name is Zaina Bamansere. Well, for April no more about fistula, my colleague Lucy Imanet Aliu been go work at the Abadi Women's Center. Usai been talk to the program's manager Alexandra Ribi and Feremusu Kamara when a fistula supervisor at the Abadi Women's Center.
Where can lead to this condition?
Okay, how long fistula don't they exist in a salon to be precise?
Well, like I say, now like with the time when we come, the hospital come into existence because fistula, I should say it go down the day, but since the projects not be there for them, and people not be they go out for go identify woman and we guess the condition. Like first, now from 2005, where mastership, I'm not sure most people know about mastership, where them they cancer alone and them they conduct this surgery. And then call this initiative here. And also because of only 1 or 2 research and then say woman in this rural community, most time because of this home delivery here, can end up develop fistula. So and then call this initiative until more mastership go Abadi Women's Center when I sponsored by Glow Foundation with England, Scotland. We then say continue the project 2009. This fistula project, but I know say fistula only exist from time immemorial.
So from when I don't begin the get them cases of fistula or then treatment of fistula from when you done there to now, what's in the difference? Will they get increase or decrease by the time?
Well, we they get decrease because before previously over the years until they get them 500 woman surgeries what they get them 400. Well, like last year 2018. Like a 200 surgery, and where would they go into the communities? They also like not like a before where we they go, we can get a large number of women they hold the carry. But now if we go like we can go there with screening then like we really need for such well for make we able identify able get patients there. So like really the message don't they go out there and the awareness don't they do in the community there because now even the health centers there, the village heads there, let's have the help for pass on this message here at least for discourage this home delivery when are one of the main factors the way can lead to this fistula. So the awareness don't they out there, the number they decrease, it don't they decrease.
So how I can go about for doing awareness campaigns?
Like if we get because we plan for the October camp. We can get like a radio program working on then different radio station and then different community there in their own languages. Like we say, if this side, if not like a Mende in the talk na ya, you say the radio station will make the translation for me in Mende in the way the people will able to understand. We will in that sensitization program, they will tell everything a fistula, waiting the cause, how for preventer, or when you get fistula, who side for go, or if you get from where you get fistula, who side for go, can share out with contact, and even also we the fistula nurses there, even working on the sensitization program then they, where we reach them community then we can go on air and try to get like a talk show where we go talk to the people and back about fistula, tell them about organization and all.
Okay, so on the organization they take any woman we get fistula problem.
Yes, what's na fistula? We dey take you, we dey admit you, give you medication, we treat you, everything are free. Once na fistula, everything are free.
Whether rich or poor.
Whether rich or poor, na free.
But when I get other things, the more know they when I just concentrate on slum woman and all.
No, like we got other things where we dey do as organization, but we get we on a 5 clinical they run when self na free. We get we maternity unit where we dey run itself na free because for vulnerable people the less privileged people will not able to afford better medical facility, we not get the money, and then we dey cater for about the women center. We go for like a come fistula woman there and conduct surgeries for them. But we surgery will be get in 10 million I don't go. But yeah.
So tell me about this camp owner they for organize, how the treatments get for go like and all.
Like this camp we dey organize, most times when we dey conduct camp now for like a difficult cases there. Like a specialized and a possible a professional on fistula surgery, because we can get surgery on ground, we can do like then minor surgeries then, because as I said earlier, it depends on the severity of the damage. Some cases then it can so big that the doctor on the ground not able to do them, so it will wait for the like the specialized person. Like this camp now we dey get them, we can target like a 50 or 60 women then can be we target. In the camp, we prepare them, admit them, then go through counseling process. Like it can mean like a 2 weeks camp, because that's how the way they come, you know, can come for county. So within that 2 weeks day, if I operate all them 50 or 60 or 40 patients and we don't get. When you come, you doing surgery, then you go, then we the fistula nurses them, we they continue the management. After the management, like when they don't well, like when don't do the surgery, the one that we don't know well, we get to can call gladi na way for celebrate the woman there. We don't know regain their pride and their dignity back. If I make them go to a community, they don't go like that kind of pussy we be calm. We will make new clothes, they sew clothes for them. We they do their hair, we they relax here, we relax their hair. We will make up them, plant them, make up them, give them fine clothes. We can invite drummers there, like we camp na camp, so we can get big gladi, we can get beaucoup patients there. We can even invite dance group, they can come, we could do rehearsals, they can sing, dance, they can act skits on fistula. From there, we can pay them transportation and then return them back to the community there. No, even though women are working, we can call them prolapse. And then people like say woman bruising, you know, relate to them. Person will get prolapse can also leak urine, but spile different from fistula. Like 2 different things.
Okay, now through the screening and I go for like differentiate this.
Yes, not through the screening, because woman will carry, so you say I leak urine. But now when you screen, you go able to know if really it's positive, because we can do a test. If the test positive, it shows say na fistula I get. If the test negative, we can advise. You can go to a medical hospital and then go on test by human and see what happen to you.
Oh, so yeah. Test the proof say person get fistula.
Yes, we get what you can call the dye test. You can do the dye test for confirm. But like in the case of ureteric, like what I say, they want to undergo surgery when they can ureteric fistula now. You get what you call swab test. If we do the dye test in negative, but we see say this woman still they look urine, we can do a swab test. If we do a swab test, it's still negative, then not a fistula, okay, advise you for go for medical checkup.
So isn't this dye and this swab really mean?
Well, the only way you able to understand, like if you do what they do, dye na like something like I don't know if we like I said that sabi how that GB in color. We use the dye like a powder form. They mix out with saline. The saline water na like a salt. Yes. They mix out with saline. We dilute her. Where we examine the woman, we get with position, we get with procedure. We go position them and do the test. because therefore they use that we use the dye, put on a 60 ml syringe, then we get with straight cut, we get with speculum, and then see how we can use, even though you know to medical person not go able to understand, and then see how we can use, we do the test. Like, so if you do the test, put the dye inside the bladder, connect onto the urethra or put it inside the bladder, then we pump the dye. If you see the dye they come out, which means holding na the piece bag. But if you do that dye test, they say nothing not come out, which means in negative. So the person needs further investigation what's in cause the leaking. Okay. Because at times people with cancer, well, when I'm cooking screen for find out, because if person gets cervical cancer, we open in vagina, you want look at in cervix, you go know. And person where you get fistula, we look at the cervix, we open in vagina, you do your test, you go know. You will tell the difference. That's now we I make patient not just they can't really say they leak urine, you conclude saying a fistula I get. Only way you don't screen, get your results, now then you will conclude saying this person a fistula I get. No, this person not a fistula I get.
So infection, urinary tract infection, vaginal infections of any type can lead to fistula.
Yeah, some people when they can get like and severe infection. You go find out they tell you say bad water they come up at me. So like that case then na treatment in it. They need for the infection will affect her. Then we can get like cervical cancer. We can get some people like where they can do age because of their muscles and all weak. When they will control PC again. So like put piece more then but when they go the piece don't come out because of the age. Now get some people they mark because of when some mark in diabetic they get pressure. Most of them people when they don't carry age. Not with young people they go carry complain say they leak, piece they come up at me. If you have piece more than me so before they don't come up. In any cases they need for to get the underlying cause. But if person can't that case they don't explain to when so they happen to me. We not go just tell and say we're not so fistula you get. You go watch you still. And from there, we send it to the appropriate hospital where you for go. But we not only fistula we deal with now.
So bad water, safe, not get anything for the
fistula? No, not get nothing for the fistula.
Okay, so finally,
it's possible for me post when not born it get this fistula.
It will only possible if the person, if you not born it, but it undergo surgery, abdominal surgery. It's possible. Now if you can't tell me say, I look urine, but I don't want they born it. We'll ask you say, you don't ever undergo any surgery? You don't open belly. Someone can say yes. Hey, for me do that operation. Now I see piece take come up for me. I'm not able to control her. Straight off you will notice something. You will tell you fistula don't develop. Can not do surgery person they get her. Though some people like what I say rape. Some people like they don't want they born it. But go tell me say the mama go say or the pikin go say from where them rape me and they go old piece get the piece by myself. Or okay accidents. Like some people they can get accidents due to that process. Sharp objects go inside their vagina and interfere with their bladder. It begin cause leaking because but now on rare occasion you can get that. Most times now on this delivery side we can get this fistula.
Alright, so what's your final message where you go send to family?
Well, my final message now for like encourage everybody, encourage me company woman then when you get belly, go na clinic. Hospital na mota man and they not to devil and they go na clinic. The only way you go na clinic if any complication get for arise. Then go no. Not only for go the antenatal clinic, where you go na house, where you belly at. Not allow that mommy for go begin they put hand by you. Or go tell you say, hey yeah, mama go tell you when I am be the born to this mommy, I am born on all. And they say for go born. Everybody different. Your mama been do a fitter. But until you will do at the end of the day get repercussion, you end up develop fistula. So I encourage everybody for they go na hospital where they get belly or then get belly at, make them go born na hospital. And then again, so me company medical practitioners there. If you na midwife, if you na birth attendant, woman go for go born to you see and say complication don't arise, not delay because this late referral also na one of the effects then this way they lead to fistula. So if you don't say this case they be on you, refer before time, before water the pass that other woman end up develop other thing where you self as a person you will end up regrets. And when you get fistula, if you get anybody in your community, you sabi anybody in your village where you know say you don't get this condition, about the women center na they we dey for. You don't always open to una always welcome for Kanaya. We dey give free fistula treatment. You know they pay nothing from the day where you can with hospital to the day where they discharge. About the women center and they responsible for you. So and that I get for tell me family.
That's Amefere Musu Kamara, fistula nurse at the Aberdeen Women Center. Well, as I go draw the cutting down for today's City and Health Watch program, plenty thank you for who join me at the program. In case you missed part of the entire program, tune in again Monday afternoon for a repeat broadcast. May we don't make the program reach you. My name is Zaina Baman Sere, they say tata.
This na CTN.